The following is brought to you by CHI St. Vincent.
Hey, welcome back to Good Morning Arkansas. The time now is 9:07. We're so happy to have Dr. Yalcin Hacioglu here, and he's with CHI St. Vincent Institute. And we're talking about venous insufficiency today. What is it? The treatment options at CHI St. Vincent Heart Institute. Thank you so much, Dr. H, for coming in. We appreciate you stopping by.
Appreciate having me here.
Venous insufficiency, for the folks at home, what does that mean exactly?
Okay, venous insufficiency is a condition that affects the veins primarily of the legs, where we have a problem with the circulation of blood back from the legs back to the heart. Under normal conditions, veins are able to provide efficient flow despite of having the gravitational forces that are in play in the legs. Okay. It's able to do that with the help of the valves. We have maybe 30 or 50 valves in the major veins of the legs that with each slight change in the pressure, the volume are opening up and then let the blood flow propagate to the higher level, and with a drop of pressure they close. So despite of all this low pressure system, the blood is efficiently moving upwards and propagating back to the heart. Okay. Now there are conditions when the valves fail, and that's when the problem starts. And you can imagine the valves are not able to close, so the blood goes back and then refluxes backwards. So we call that a reflux. And if the majority of the valves are affected, then we have a condition called insufficiency, which results in various symptoms and findings.
What are some of those symptoms?
We could vary from minimal symptoms like swelling, little cramping, and just bulgy veins.
Like varicose veins?
Varicose veins, okay. And all the way to the venous ulcers that are open sores that just don't heal well, and over time can get infected, and that infection can spread to the surrounding tissues, and in rare cases you can even have an amputation. Oh, wow. So it's a wide spectrum of symptoms and findings with this condition, and believe it or not, it's very common. Really? It's up to 1/3 of the adults in various screening studies have shown that they have some form of venous insufficiency.
Just different levels.
Just different levels,
like
depending on how many valves are affected. So wow. That's why you'll be having it, and for years you wouldn't know that you had it there.
Okay. What about risk factors?
So the risk factors, age is number one. Okay. It's more common of patients above 45. And then gender, usually female population is more affected, especially pregnant women. It's a higher risk. Then obesity, unfortunately, because there's different levels of compression of the veins that affects the blood flow in a bad way. Then family history. Okay. It's pretty common, to see actually a higher number of men have a family history. And then certain occupations, if it requires standing up for a long period of time, sports like heavy lifting. Oh, really? All of those are really affecting the circulation in a bad way.
How would it affect the heart, or would it?
Well, actually, the relationship between heart failure and venous insufficiency is kind of inverse. Okay. Because as you know, swelling in the legs could be a sign of the heart failure. And many times we are referred because of swelling, and we tend to find no vein problem, but heart failure. So they're kind of overlap, the symptoms overlap. And in case you have a venous insufficiency and concomitant heart failure, that just makes the insufficiency worse, and you can't efficiently treat it if you don't treat the heart failure. So they're kind of overlapping, and you need to address both these conditions, especially in the severe cases.
Speaking of treatment, what treatment options do you utilize at CHI St. Vincent?
We have various ways of prevention and treatment of this condition depending on the level of this disease. Okay. But pretty much everybody benefits from weight loss, exercise, prevention of long-standing, and then using compression stockings. It's our mainstay for treatment of all patients. Oh, really? Because that provides compression of the veins, and that kind of detours all that circulation into the functioning veins, usually the deeper veins, and that kind of reduces the swelling, pain, and prevents progression into the venous ulcers.
Prevent progression. Sounds like early detection, realizing something like this is just vital in the process.
Very important to recognize it early and treat it early, because that may prevent progression to the worst stages.
If someone feels like they have any of those symptoms that you talked about, or sees any of those kind of changes, would they call
so it starts with awareness first, being aware of the swelling, varicose veins, ulcers, and contact the primary care physician or our clinic here at CHI St. Vincent Infirmary. plus Heart Clinic Arkansas. That's a consortium we have there. We'll be happy to assess them, and we also have a special test called venous insufficiency ultrasound that really helps to determine the level of the reflux in the veins.
Okay.
And once we have the right diagnosis, we have multiple methods, including invasive methods like radio frequency ablation, venous seal, which is like a super glue that closes the vein, then also sclerotherapy. We have all these treatment options available in our hands, and with a great staff that is always attentive and very quick to schedule appointments and turn around.
Wonderful. Well, if you have any of these issues, or maybe you know someone who does, who's been complaining of those issues that we talked about today, then make sure you get ahead of the curve. Give them a call over there at CHI, and they're going to take great care of you at St. Vincent's. They always do. Like Dr. H was saying, they have a great staff and crew over there. Will get you the right treatment based on your specific needs. CHIStVincent.com. Thank you so much, Doc, for coming in this morning. Coming up next after the break, we're talking diamonds with William from Sissy's Log Cabin.